you know what? It will not drop your blood sugar at all. It doesn't drop blood sugar. It can normalize somebody's blood sugar who has high blood sugar because they're lacking in one of those nutrients. Like I actually did have a patient that had a chromium deficiency and had diabetes because of a chromium deficiency. So we added in chromium, and all of a sudden she's got perfectly normal blood sugar. But it's not going to drop blood sugar. It doesn't. That's not what it does. So then the question is, does the cinnamon drop blood sugar? No. The cinnamon more makes you insulin sensitive with high insulin levels.
Hey guys, welcome to the Fixed Blood Sugar webinar. Oh, there he is. We're excited to have you guys here today. It is me and Dr. Saunders in the house. I was gone last week. I actually had knee surgery, so I missed you guys. I'm barely able to be on this call, actually. So recovery is not fun after surgery. But I'm glad to be here. We're going to talk about a fun topic today because it's Valentine's Day. And so no better time than to talk about diabetes and your heart. So I'm excited to chat with Dr. Saunders about all of the connections there, what we need to look out for, what we should be concerned with, and any of the questions that you guys have that you want to ask. Before we get started, I just want to mention that Dr. Saunders is not your doctor. And so anything that we discuss today, please talk with your provider before you implement any of these things. Also, you can find more information about these webinars at bartonwebinar.com. Use code webinar25 if you see anything there that you're interested in purchasing. I'm going to post that in the chat as well so that you can see exactly how that needs to be typed out. But looks like we have quite a few of you guys hopping on today. Eric is here. Hello, Eric. Guys, I got my Valentine nails on. So fun, right?
That's awesome.
Should have been a teacher, honestly. I would have been great in elementary. Oh, well. Okay, guys. Facebook isn't working either. Won't let me share it to Facebook. So not sure what's going on. Tim is here. Hello. Say hi when you guys hop on. Just if this is your first time, questions, we love your questions. The best place to ask those is in the Q&A. You can post them in the chat. I won't necessarily get to them because every time a new chat comes in, it gets pushed. And so it's hard for me to manage those. So just a heads up, Q&A is the best place for questions. We'll get to as many as we can. YouTubers, hello, welcome. bartonwebinar.com is where you're going to find more information. We'll get to your questions as well when we can here. And I think we're going to get started. Let's do this. Let's talk about our heart and diabetes. Dr. Saunders, take it away.
Okay, so there's always been known connection between diabetes and heart disease. But if you ask yourself why, you go, well, why? If the blood sugar's high, and the heart runs on sugar, then it should be okay. There shouldn't be any problem with the heart and diabetes. However, there are a lot of complications with that. One of them is that we don't think about that there's a certain percentage of the heart that runs on fat. And that when you have a lot of insulin, that blocks you from using fat. And when you have insulin resistance, then you get resistance to the glucose transport proteins as well. So getting energy into your heart is a problem when you have diabetes in both ways, both the sugar and the fat. So the cells are running out of energy. What do? Well, they have fewer mitochondria. So a normal heart cell has about 40% of the cell. So you have this heart cell, it's a muscle cell, right? It contracts and then it relaxes and then it contracts and relaxes. 40% of that cell is filled with what's called mitochondria. Those are the little, they're kind of like bacteria that live in the cells that make the energy for the cell. So they're pumping out energy constantly. And they have this constant supply of energy. So your heart never has to relax. It just goes beep, 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 beep. It keeps going and going and going and never stops. If you were to do that with your skeletal muscle, if you were to my brother told me when he was in the Army that their punishment was to hold something out. I don't remember what it was. It was something like but they had to hold it out in front of them. And, for 1 minute, big deal, right? 2 minutes, it's getting a little heavy. 5 minutes, no way, you can't hold it up. And your muscles are cramping and it's hurting. Why? Why does it get heavier and heavier and heavier as you hold it out there? It's because your skeletal muscles are only using a few of your muscle fibers, only the ones that are needed. So just out of all those muscle fibers, only one of them is contracting. And it contracts, it takes a while to relax, so then another one goes. And then while that's relaxing, another one goes. And then while that's relaxing, another one goes. And so it takes them a while to relax. Why? Because they don't have 40% mitochondria. They may have 1,000 mitochondria or 100 mitochondria, depending on how much you've worked out and how much muscle you have. So and that 40% is tens of thousands of mitochondria. We're talking about the heart muscle has 10 to 100 times more than your skeletal muscle. So your skeletal muscle is going to fatigue as you're using it, and then it takes longer and longer to relax because you have less and less of the ATP, and pretty soon you get cramps. What is a cramp? Well, a cramp is when you can't relax. It takes energy to relax. Energy is required to relax, not to contract. It's like a mousetrap. You have this the old-fashioned mousetrap where you have to set them, you have to and then put the little thing on. Okay, now don't touch it, right? And then your brain just has to send a little signal, just go tap, and bam, it goes, right? That's what your muscles do. But once it goes bam, then you have to put energy into the system to reset it. And so your muscles, while they're relaxing, some of them are contracting, and then other ones contract, and then other ones, while the other ones are relaxing. And so you have that kind of a thing going on where your muscles are changing all the time. Sometimes you can see that if you're holding something up where that's really heavy, you can actually see your muscles going like, they're like worms inside there. And all it is this fascicle contracts, and then this one, and then this one, and then this one. And it gives time for that one to relax, and it can contract again. Your heart doesn't have that. Every single muscle fiber goes every single, second, right? Once a second, 60 times a minute, right? So it's going boom, boom, boom. Every single fiber has to contract. If you don't have enough energy, then they don't go like that. So that's when people get what's called atrial fibrillation, where they have some of them are going, and then the ones that are taking longer to relax don't fire. And so instead of everything firing together, it's like this one's going, and then this one's going, and this one's going, and then you get what's called fibrillation, where they're going all at different times all the time. And if it's in the atrium, it's not a big deal, except you can form clots and end up with a stroke from that. So it's kind of important that they all contract together to pump, because if you have some of them contracting, it's called ventricular fibrillation. That's death, because if your ventricle is going like this, it's not pumping anything out or anything significant, and so you're gonna die from that. Well, diabetes prevents those muscle fibers from getting the energy they need. So what happens is you get fewer and fewer mitochondria, and then you get what's called congestive heart failure. This is very common with type 2. Is instead of like every contraction you're pumping out like 60 to 70% of the blood, now it's only 50%, and then it's 40%, and then it's 30%. They're all still working together, but they're just only contracting part of the way. So that's called congestive heart failure. Very common with diabetes because of a lack of energy. So when you put the energy back in the system, then things start working again. You actually get your heart back. So the heart is so important in diabetes, and the energy system of the heart is so important. And diabetes is a metabolic problem, and that means it's an energy problem. It's a problem with making energy. So give your heart some energy. How do you do that? Well, we start you off with a very simple way of doing that. Start off with limiting the number of carbohydrates that you eat. So take out the carbohydrates because you're toxic on carbohydrates. And you have this really high insulin level that's blocking your ability to get energy into your heart, this insulin resistance. So what you do then is increase your insulin sensitivity by limiting the amount of carbohydrates you eat, ideally by eliminating sweets entirely, and then decreasing the amount of food you eat. Another thing that's very helpful that we often talk about is limiting the time period where you eat 2 meals a day, 8 a.m. and 4 p.m., and avoid snacks. And that makes a big difference too. So what that does is allows time for the insulin to go down so that you can be sensitive to insulin. Then you don't have insulin, so you can get fat into your cells, you can get sugar into your cells, you can get ketone bodies in your cells, and you'll have plenty of energy and the heart will start working again. So people who have chest pain, shortness of breath with walking, that's recoverable. You can totally reverse that. That's what we teach here. That's what we want you to do.
Awesome. Let's talk a little bit about, we host a webinar on Thursdays. It's called our Healthy Heart webinar. And one of the things that we talk about a lot there is the benefit also of increasing our fiber in our diet. Is that something that you would recommend for someone with type 2 as well?
Oh, yes. Fiber is really good for a lot of other reasons as well. Number one, if you eat any carbohydrates and you have fiber, the fiber will slow the absorption of carbohydrates so you don't get spikes of sugar. It prevents the spikes. So fiber is really good for that. It also helps you grow the good bacteria in your intestines. And that good bacteria, why is it so good? Because it's making things like butyrates that help lower inflammation. Lower inflammation means less insulin resistance, and it means you use your sugar better. So yeah, fiber in your diet is a really good idea.
All right, I'm going to dig into some of the questions actually that have come in already. We have quite a few, and I love this. We had somebody send in some of their results here. So Tim said that he received the results and it shows that his C-peptide result is 1.4. First of all, what does that mean?
Okay, C-peptide is it's a marker. It's a little piece of your insulin protein that comes from your pancreas. And it's a waste product from your pancreas that says, this is how much insulin I made. And it gives you more of an average, like over hours, instead of like insulin is minute to minute. It's really quickly changing, whereas the C-peptide will give you sort of an average of that over hours. And so when you're fasting, your C-peptide should be right around 1. So if it's 0.8, 1.2, that's okay. 1.4 is a little higher. What that means is you're making insulin and you're making enough insulin. You do not need insulin injections at all. That's what C-peptide is telling you, because that's coming from your pancreas. That's not coming from, like, if you were injecting insulin, that wouldn't even show up in the C-peptide. So this is only from the pancreas. This means that your pancreas is making enough at 1.4. If it's 1.8, that's a little high. 2 is definitely high on a fasting specimen. Recently, yesterday, I had somebody that was 3. Their C-peptide was 3, which is really high. That's 3 times as much insulin as a normal person would make on a fasting specimen. So that gives you that idea.
Okay. He also said, I don't have an appointment until April 29th, so I wanted to get an explanation of this result and any advice or steps I should take. I've been getting an average glucose reading of 133 via my Libra 2 monitor, and I've been taking 2 units of Humalog before I eat, but don't take anything at breakfast. I tend to get a low glucose reading of 70 to 78 around 3 a.m. every morning. I also take 10 units of Lantus nighttime before bed between 9:30 and 10.
Oh, very interesting. So how do we interpret that? Okay, the Humalog is the quick acting. That's gonna onset in less than a half an hour. It's gonna be gone in an hour or so. But the Lantus is very long acting. It should be essentially 24 hours. It's not really 24 hours, but that's what they say. It's the Humalog that generally causes the low nighttime readings. But 70 to 78 is great. So here's the deal. We already know from your test that your pancreas is working, that insulin is not even necessary. So then how do you handle that? Well, that's why we have the diabetes solution kit. If you follow the book, then you'll see how you can lower your blood glucose by diet and not need insulin, because the insulin injections are causing more insulin resistance. And that's something you don't want. Remember, the problems of diabetes, like amputations and dialysis, renal failure, and Alzheimer's or dementia, that's all from insulin resistance. It's not from high blood sugar. Well, it's partially from high blood sugar, but they're correlated. But the real problem is insulin resistance. So as you increase the insulin, you increase the rates of complications of diabetes. So yes, your pancreas is making insulin. You probably don't need any.
Awesome. Okay. Let me just quick show you guys. Here's the diabetes solution kit in case maybe you are on this webinar and you've never seen this. This is primarily what we talk about on all of these webinars. This is what Dr. Saunders basically recommends to his patients in his office as well. And you can find this at bartonwebinar.com, but it's a very small book. You can get the downloadable version instead of this hard copy, and you can get it right away for under $20. So this is really good information that talks about how to eat, exercise, stress reduction, all of those things. There's good recipes in here, and mostly all low carb and some fiber. We encourage you to add in as much fiber as you can as well. There are a lot of questions that are coming in about synochroma, and so this is going to be fun to address too. First of all, let's just put this out there right away. If someone has just been diagnosed with type 2, should they just use synochroma to try to reverse their type 2? Or should they use the diabetes solution kit?
It depends. So synochroma is not something that for reversing diabetes. That's not what it does. It is a support for people to have sufficient nutrition in areas that are commonly deficient. So it's common for people to not have enough chromium in their diet. It's common to not have enough selenium. It's common to be deficient in vitamin D. So we put these in there so that you can have sufficient nutrition to support your program in doing the diabetes solution kit. So doing the book, going by the book, is more important than taking the synochroma. Synochroma is a support and help for you in the process of doing the program. So the program is the primary thing. The synochroma is secondary.
All right. Let me go back here to the top. Ed says that he recently started drinking lemon water. Can he mix fiber greens with the lemon water?
You can, and that sounds like tastes pretty good, but remember that fiber greens has an artificial sweetener in it that may cause insulin resistance. So on this program, because people have insulin resistance, it's probably not a good idea to have fiber greens.
Okay. And Jan says, how much impact does LDL have on blood glucose and blood pressure?
Probably very little to none. There isn't an association specifically of LDL with either blood pressure or blood glucose. However, the other way around, if your blood sugar goes up, and you have high insulin. Insulin's a growth hormone that tells your liver to make more LDL. So it can happen the other way around. So if you get your insulin resistance down, then the LDL goes down. And the blood pressure goes down. So both of those are related to insulin resistance.
Okay, Beverly wants to know what the purpose of bioprene is in turmeric BP.
Okay, very good. So the word BP stands for black pepper, not Barton Publishing, right? The black pepper, the bioprene, is a extract of black pepper that helps you absorb turmeric. So if you just take turmeric, like the plain herb or turmeric, you're going to get very little of the curcumin, the active ingredient that lowers inflammation. So the BP helps you put from the black pepper, helps you absorb like 22 times more. It's huge. It's not like you're absorbing twice as much. It's like 20 times as much. It's a very big difference. And so if you ever see a turmeric supplement that doesn't have the BP in there, then you should take it. You should take it with black pepper, or put black pepper on your food when you take it or something. It really makes a difference.
It's good to know. All right. I had another question about black pepper too. And I think it was from a question that came up maybe a couple of weeks ago. And someone wondered if we had figured out, let's see, I don't know where it is. There it is. Do we know the percent of black pepper to turmeric? It was a question that came up in another webinar. Any idea?
Yeah,
I don't
it's really low, and it just said it on the label. The label tells you like 5%. It's really it's pretty low. It doesn't take a lot of black pepper, because really it's an aid for absorption more than anything.
Okay, so on turmeric BP, the black pepper was 5 milligrams is what we
Yeah.
put in there. So, and turmeric was 420.
Yeah, so it's a really small amount.
Okay. All right. Mirabella says, is Cinechroma likely to drop the blood sugar too low for a person who is not diagnosed as diabetic and takes Cinechroma?
That's a great question. Yes, you know what? It will not drop your blood sugar at all. It doesn't drop blood sugar. It can normalize somebody's blood sugar who has high blood sugar because they're lacking in one of those nutrients. Like I actually did have a patient that had a chromium deficiency and had diabetes because of a chromium deficiency. So we added in chromium, and all of a sudden she's got perfectly normal blood sugar. But it's not going to drop blood sugar. It doesn't. That's not what it does. So then the question is, does the cinnamon drop blood sugar? No. The cinnamon more makes you insulin sensitive with high insulin levels. And so it's a different way of doing it. It will not get you to a hypoglycemic reaction.
All right. This is interesting because we have a message here from Carlin that says, it could be Carolyn too. Cinechroma has helped decrease my A1C from 11.8 to 6.3. And
wait a minute, that's a huge drop.
It is.
And that's just from Cinechroma? She wasn't doing the program? That's interesting.
Let's see what else.
Okay, I take back everything I said about Cinechroma.
Yeah. But it can be one of those cases where maybe someone is really deficient, I don't know. Okay, so and glucose is at 101 over the past few months. Thank God. I'm losing inches, but I need to lose more weight. Blood pressure is high, 151 over 91, high inflammation. C-reactive protein is 6.3. My daughter has high cholesterol. What supplements and foods should she use to decrease cholesterol levels, and which foods or supplements to avoid? Is vitamin B12 helpful? Thanks so much for your incredible work and for being here for us.
Okay, so the vitamin B12 is not something that's going to lower cholesterol. The best way I've found to lower cholesterol is a high fiber diet. I had someone come in. You know how like some companies, they'll give you a bonus if you meet their goals of your cholesterol level and all that stuff. And he was like right above the level where he wasn't going to get his bonus. So I said, okay, here's what you do, because you only got a couple of weeks. So I put him on a super high fiber diet. He was eating 40 grams of fiber a day, and he cut out all sugar, but he was having a lot of fiber, and eating food with fiber. So vegetables, especially like cruciferous vegetables, brassica vegetables. So the next time he tested, like right before the deadline, he tested, and his cholesterol HDL ratio dropped below 3. It was actually even better than they recommend. And so he got his bonus.
Nice.
Yeah, high fiber for if you want to lower cholesterol, that's the best way. What was
And then
what was the
what about
first
that?
part of her
There
question?
was a blood pressure. She said her blood pressure is a little bit high.
Yeah, the blood pressure 150/90. That is that's kind of a borderline pressure. You know, when I see 150/90, I tell people get a blood pressure monitor and check it twice a day. If it's like consistently like higher in the morning and lower in the evening, then that means something. If it's higher in the evening, lower in the morning, that means something. If it's consistently elevated, that means something. If it goes up and down and is not, there's no specific pattern, then that's something else. So those are all different things. So get a blood pressure monitor, monitor your blood pressure, and see, because the question we're asking with blood pressure is not does it ever go up. Everybody's blood pressure goes up. I walk into a dentist's office, and the dentist offers to take my blood pressure. I'm no way. I refuse every time because it's going to be high because I'm stressed, right? So I don't let them do it. But if when you're quiet and relaxed, it should come down to normal. If it never comes down to normal, then you've got a problem, and you've got to find out why. There's hundreds of reasons why it could go up, and so finding that reason is really important.
I think there was another question in there too. C-reactive protein was 6.3. Thoughts about that?
Oh yeah, CRP. 6.3, that's high. And CRP, C-reactive protein, is not, it's an inflammatory marker, but it's not like the inflammation of like an infection. It does have that too. It's just not the same type of inflammation. It's actually better described as a cellular distress marker. So if you have a lot of insulin resistance, your CRP is going to be elevated, but the sedimentation rate will be low. And that means it's really low inflammation, but high cellular distress, because cells are supposed to be able to live off of fat. And if they can't live off of fat and they're required to use glucose, they're going to have more inflammation, they're going to have more oxygen-free radicals, and they're not going to run as efficiently. So that's cellular distress that's created by insulin resistance. So that's an important thing to look at. Instead of looking at it in a microcosm, just that one little thing, look at the big picture and say, wow, is there insulin resistance here? And then dealing with that first. And if everything comes down to normal, then you know you've dealt with it. That's it.
All right. Another question here from Nazir. Hello, doctor. My name is Nazir. I'm 69 years old. I have type 2 diabetes. I ordered 3 bottles of Cinechroma. And 2 questions. When I saw the other ingredients, it says it has gelatin in it. What kind of gelatin? Is it from pork or cow?
I think they're all.
I don't even know.
I
Actually,
think it's vegetarian
I was going to
gelatin.
say, I think they are
Yeah,
vegetarian.
yeah, yeah. And then
99% sure.
that's just the capsule.
Yeah.
I remember being at UST when we ordered it, and we specifically said vegetarian capsules.
Yes.
So
because we're shipping all over the world, and we wanted to make sure everyone could have it. So, okay, let's see. I have a problem with my A1C level, and I want to bring that down. And when I get up in the morning, my fasting glucose is out of the normal range. I'm on Jardiance. Is Janumet kind of the same thing? Are they the same? Okay.
No, Janumet.
Okay, so Janumet and Jardiance, it does not help me. When I watch your video, I understand that I might not have the problem with pancreas damage rather than zombie cells. I have a long history of international basketball playing, and I'm active now too. Would you please advise me on how to use Cinechroma to solve my problem?
Okay, don't use Cinechroma to solve your problem. Okay, take Cinechroma just once a day. That's all. Just in the morning with breakfast, just like it says. That way you'll be sure you have enough of the right cells. Now, if you want to fix your zombie cells, I actually looked this up last time we talked about it. I had to look it up. So if you want to fix your zombie cells, the only way to repair them that we know of is fasting. So how long to fast? Well, it takes 3 days. It takes 3 days of not eating to repair the cells, to go into autophagy, to get rid of the dead cells, and to wake up the normal cells. So that is a good thing to do. The other thing that you need to know with those medications you're taking is what your insulin level is and your C-peptide level. You need to know that. Because those medications, except for the Janumetis, Januvia, metformin, so 2 of your medications are causing you to increase your insulin level and may cause insulin resistance. And only 1 of your medications is helping you to burn fat for energy. That's the metformin. So you need to know what your insulin level is and how your pancreas is functioning first before you decide whether you need those medications or not, whether you need insulin or not, or how to change your diet, or even if you don't even need those. So having that information, so C-peptide, insulin level, and then your hemoglobin A1C and glucose, those 4 should be adequate to tell you what your next step is.
Okay, and I did get a message from someone on our team that our capsules are gelatin, which is an animal byproduct. They're trying to switch them out, but they're not done yet. So possibly bovine, but we don't know for sure. So just an update on that. But it has been a discussion, which is why we both thought that they were. Okay, so let me see here. So many good questions. Anonymous said, taking turmeric, BP, and synochroma currently. Blood pressure is 117/74 on average after only 2 weeks. Plus, though, still in the 90s. Oh, pulse. Pulse, though, still in the 90s at best. Also high fiber and intermittent fasting, but carbs are in the 40 to 60 range.
Wow, very good.
Pretty good.
Okay, 40 to 60, that's the phase 2, right? Is that, that would fit, right? Okay, so the pulse being elevated in the 90s generally means that the heart, and that's what we're talking about today, that very thing, that the heart is not pumping like each time enough out. So it has, it's pumping out less with each beat, so it has to beat more times to get the same amount of circulation. Does that make sense? So the way to get it to beat more is to increase the energy. So the way you're doing it, working on that is phase 1 is a good start for that. So decreasing insulin resistance or improving insulin sensitivity is the other way to look at it. But don't forget exercise. That increasing exercises increases your the heart's ability to pump, and you actually make more mitochondria, those little powerhouses in the cell, as you exercise more. And so people who are like marathon runners, their heartbeat sometimes in the 40s is like boom, boom, boom. and you listen to their heart and you're like, let's see. Your heart is gonna. What? I'm sorry. I got. When you're listening to somebody's heart who's a marathon runner, then you just like keep going, don't stop. It feels like it's gonna stop because it's so slow. So the fast heartbeat indicates that it's not efficient, and you want your heartbeat to be ideally in the 60s. That's what you're shooting for. So exercise and increase your exercise gradually until your resting heart rate is in the 60s.
Okay. Mirabella says, how does Nervala improve circulation? Does it remove or destroy the plaque? And if so, how does it do that?
Oh, that's really interesting. No. It's they're vitamins and antioxidants. So that has only 2 ingredients. One is benfotiamine, which is a vitamin B1. It's a fat-soluble form of vitamin B1. So it can get right through the cell membrane, in the blood vessels, through the glycocalyx and into the endothelium and repair the lining of the blood vessels. So that's what the vitamin B1 does, benfotiamine. Alpha lipoic acid gets rid of inflammation, and it's also fat soluble. It has both water soluble, fat soluble properties. So it can get also into the lining of the blood vessels and get rid of inflammation. So you don't have inflammation causes constriction. So it allows dilation and then normal glycocalyx to be fixed so that you have good blood flow again. So really all it does is improve blood flow.
Okay, I'm just going to read this so you guys know that the capsules are standard natural gelatin capsules. It says Synachroma is a gelatin capsule. This is 100% bovine kosher certified. So I'm just adding that note in here. And let's keep going here. Discount code is webinar25, all one word. And what do you think of using the new smartwatch that uses laser to give the pancreas a treatment to control sugar?
Boy, I am not familiar with that. That is completely new to me.
Through a watch.
Interesting. Watch has a laser to help the pancreas. Okay.
That is very interesting. We'll have to wait till we learn more on that. Keith says if you go on a low or no carb diet and drop insulin, will your body retrain itself to make its own insulin?
Oh, if somebody is type 1 and they don't make insulin, then there are ways that we have of improving or allowing the pancreas to start making insulin again. However, there are several possible reasons. There's different reasons why the pancreas stops making insulin. Sometimes it's an autoimmune disease where you have antibodies against the islet cells, the cells, and that damages the cells so they can't make insulin. Other times they make insulin, but you have antibodies, again, an autoimmune disease, against the insulin itself. So you have insulin antibodies that block. So you have insulin out there, but the antibodies block it so that it can't work. And that's another possible reason. And then a third one is kind of a big mystery to everybody, and that is the vagus nerve shuts off the insulin production in the pancreas. And that comes from the brain. So the brain has shut off the vagus nerve. And it's still a big mystery as to why that happens and how it happens. But it was even seen in mice that were genetically predisposed to diabetes. And when they had type 1 diabetes and they made no insulin at all, the insulin in blood level of insulin was 0. There was none at all. They put what's called capsaicin, essentially, to deplete the vagus nerve. So they put an injection of a nerve blocker at the vagus nerve before the pancreas. And all of a sudden, like in minutes, they started making insulin. Like immediately, as soon as they shut off the vagus nerve to the pancreas, it started making insulin again. So sometimes there's a nervous system problem, sometimes it's an autoimmune problem, sometimes an inflammatory problem, and sometimes there's another toxin called titanium dioxide, which is found in actually a lot of foods that can poison the islet cells. So all of those could be related. So could any one of those start making insulin again? Well, yeah, we know that the one from the brain, the rats that shut off their insulin production, that as soon as they get the vagus nerve working, or actually they block it, that the pancreas starts working again. If you have titanium dioxide toxicity and you get the titanium dioxide out, then it should start working again. I don't know any studies on that. But I've had cases of other things where toxicities where this starts working again. And then the autoimmune, I had cases of people who had type 1 diabetes, autoimmune diabetes, and put them on an autoimmune protocol. And it takes months to a year, a couple of years sometimes for the pancreas to start regenerating and making insulin. And it does. So it's possible.
I just want to mention this because I've gotten a few questions about fiber greens again. So Dr. Saunders, like you mentioned earlier, recommends fiber greens is good. He just recommends it maybe not during phase 1 because of the sweetener that's in it. But there are a lot of benefits to adding fiber into your diet. So, and greens. So just to clarify that, because I know I have a lot of questions. So if you ask that question, there's your answer.
So the answer is eat the greens. Eat broccoli and lettuce and spinach and chard, and just you can have as much of that as you want. It's free food.
Okay. Someone said, what type of nutrition can you sell me to help with high range blood pressure?
Okay, there are more than a couple hundred reasons why your blood pressure could be elevated. So what you need to do is find out why your blood pressure is elevated. Now, insulin resistance causes elevated blood pressure. So if you have insulin resistance, then we can sell you a book. And if you follow the book carefully, go to page 1, fill out all the little forms that we have on what is your why, and why are you doing this, and are you committed to doing it? It's all part of the program, and go through the whole program, and your insulin sensitivity goes up, then your blood pressure will come down.
There's another question about, let's see. So Roland had also asked, what do you recommend to try to lose 1.5 inches of belly fat?
1.5 inches. That's all you need. 1.5 inches. I had a woman who, she was going to her 50th high school reunion. So you know how old she was, and it was on a cruise ship. And she says, "I'm not going on the ship looking like this." And I said, "What's the big deal?" She said, "The belly." And I'm like, "Okay, how much time do you have?" She said, 60 days. I'm like, that doesn't give us a lot of time. So she went on a broth diet where she drank only broth, 16 ounces twice a day for 30 days. She lost 33 pounds, and she fit into the dress she wanted, and everything was great. And she said, even after she came back, she said, I went on the ship and I ate anything I wanted and I didn't gain it back. So I'm good.
Awesome. Okay. Oh, we got a lot of questions about fiber greens. Everyone likes their fiber greens. Okay. Roland is also asking, so he's taking metformin and a statin. Is that Avator statin?
Yeah, atorvastatin.
Okay. And so he wants to know of the products that we make, what would work well alongside that. And again, the best thing for if someone who's on metformin, I mean, we want them to get started with the diabetes solution kit. And so should they make any changes to their metformin while they do this?
Well, they don't have to, but as your blood sugar is coming down and you go to your doctor and say, "Look, I have normal blood sugar and I'd rather not be on this medication," and they'll go, "Yeah, you shouldn't probably take it." And then when your cholesterol's too low, if your cholesterol gets below 220, then your death rate starts going up. So your mortality increases with lower cholesterol. So you want to make sure your cholesterol stays in the 240 range. 220 to 250, 236 is, I think, the perfect number of cholesterol. So, and so when your cholesterol starts getting lower than optimal, then you may want to go to your doctor and say, "Hey, I'm a little concerned, and so about my mortality going up with the cholesterol being too low."
Okay, Russell said, what should blood read at 10 p.m.? In other words, a non-fasting reading.
Between 70 and 90. Because 10 p.m. you're going to be fasting because your stomach has to be empty for you to go to bed. because that's the 6:10 reset, right?
You do want to do that. You want to be fasted. Okay, so but
Yeah.
let's say he did just eat. Let's say he ate, let's say at 6 o'clock or 3, he just ate. What would you
Okay.
expect your reading to be after someone just ate?
If it goes up to 110, that's okay. Depending on what you eat, 120 might be okay. As it starts getting up more like 130, 140, 150 is definitely high. So anywhere in the low 100s, 110, up to maybe 120. But
Okay.
ideally 70 to 90.
Okay. What did I just see? Okay, what does the coronary calcium score tell you?
Oh, that's a great question. So we talk about that quite a bit on the Healthy Heart webinar. Coronary calcium score is a CT scan of the heart. So you get a three-dimensional view of the heart, and it can see all of the blood vessels of the heart and measure the amount of calcium that's deposited in those arteries. And calcium is a sign of atherosclerosis. So, and it gives you a number. So the number, it should be 0. You should have no calcium deposits in the arteries of your heart. If you have a little bit, if you're 70 years old and you have, your calcium score is 20 or 50, nothing. Don't even worry about that. That's nothing. If it's over 100, okay, you got a little bit. If it's over 400, definitely you've got some cardiovascular disease. Why is that important? Because if you do that score and it's 0 and there's no calcium deposits, then think about this. Here I am 60 years old, and in the last 60 years, I haven't developed any calcium deposits in my arteries. Guess what? In the next 60 years, I probably won't either. So and that's pretty much been shown that people who have 0 do not need statins, they do not need cholesterol medication, they do not need blood pressure medications. And so that tells you a lot. That's a big deal, right? If I had somebody, for example, this is actually a real case, somebody whose cholesterol is 300, and the doctor's like, oh, you definitely have to be on a statin. That is so important. You're just going to die easily because you're going to have all this atherosclerosis. And so I said, let's do a coronary calcium score. His number came back 0. Guess what his risk is? 0. He has no risk. He doesn't need to be on a statin. He has cholesterol up 300. But guess what? The cholesterol level is not related to heart disease. That is really important to understand. The cholesterol level is not related to heart disease. And multiple studies have shown that. In fact, we often talk in the Healthy Heart webinar, we often talk about an AI study that was done, and that is that's artificial intelligence. So they've entered the data from the United Kingdom, the National Health Service, and they put 500,000 people into the computer, into this machine learning computer, and they asked it questions like, what are the risks for dying of a heart attack? So this is cardiovascular mortality. And LDL cholesterol came out 46 out of 48. In other words, it was not a risk factor at all. So the coronary calcium score is really useful for knowing what to do about that.
And I want to let you guys know too, because I saw this question come in, that you can join the Healthy Heart webinar that we do on Thursdays by going to bartonwebinar.com. It's a free webinar. So that will be tomorrow at 12 noon Central Time. And it's similar format. So you'll get to ask your questions. And I saw a bunch of you have asked about that. So be sure to do that. It's fun. More questions here, guys. We're going to run out of time. So I'm going to see what I can do here. This is a good question. Anonymous says, what is the best course of action, step by step, before I need to take any of the products available here?
Okay, that's a great question. Thank you for asking. Okay, so the products are secondary to everything else. So your step-by-step instruction is written in the book. So you can buy a hard copy of the book, like Leslie keeps showing. That's the hard copy. You can download a digital copy of the book immediately and start immediately and you don't have to pay for the hard copy. The digital copy is only like $20, and you get an extra $20 for the hard copy. So you know what? Just you can start immediately. That's the step-by-step instructions of what to do. Everything is in there: how to lower your stress, what diet to start on, and how to do that, and even sample recipes and things to do. It's all in there, step by step. It's great.
Oh my gosh, there's so many questions, guys. Okay. Someone said that Don said my doctor prescribed me metformin, but I don't want to take it. What natural product preparation is good to replace those prescribed meds? My last A1C 5 months ago was close to 7.
Okay, close to 7 means you have diabetes. And so the answer to your question is really simple. Berberine essentially does the same thing metformin does. So there's no, statistically, there's no difference on how it affects the blood sugar either. So you can, something natural, berberine.
And our berberine is actually out of stock right now. I've had a bunch of you ask me that. So unfortunately, it'll be back. I actually don't know when it'll be back, but they're going to put it up on Barton Nutrition as soon as it's available. So, but in the meantime, really,
it's out of stock because the supplier is like not able to supply it anymore.
Yeah. But this is also a really good alternative to metformin, the diabetes solution.
Exactly.
So that's a good place to go to. Let's see. Julie says, if I have plaque in my carotid artery, as Lifeline screening said I do, does that mean I probably have heart disease?
It means you have arterial disease, and that can affect your heart. Yes. So, and just assume that, or you can do a coronary calcium score and see specifically, get a number. But that wouldn't be necessary because you already know you have vascular disease. So what you do is start on phase 1 of the program. That's a great place to start. And then go to our cardiovascular webinar, and we'll go over all of the other stuff on how to repair the arteries.
Okay, Patricia says, I wanted to ask your thoughts on hypermycemia. My blood glucose is maintained from 83 to 93 in the morning. I followed the recommendations from the book. The insulin level has been 2.4 for some time now. My PCP ordered an abdominal ultrasound because my lab work showed hypermycemia. Everything came back normal. Then he ordered a CT scan, showed my liver was hyperdense compared to the spleen. He wanted to refer me to GI. What do you think?
There is a possibility. Fructose is a fruit sugar that can cause that. All of those things, including like a fatty liver, and changes in the liver and insulin resistance, by the way. So all of that could be just from one thing. And some people are really sensitive to fructose and get this easily. Or you might look at your diet and say, how much fructose am I getting? If I'm eating everything natural, but I had a patient that actually, he says, oh, I love grapes. So every night before I go to bed, I eat a bunch of grapes. And well, guess what? That's fructose, and that fructose, when you go to bed at night, after 6 o'clock ish, your liver stops processing things, and so you just store all the toxins, and that gave him fatty liver and all of the other issues of insulin resistance and stuff, and all he had to do was stop eating by 5 o'clock, and everything went away and everything became normal. So looking at the underlying cause of why it's happening is important. So the doctor is going to tell you what's going on, but couldn't really tell you why. You'd have to go to a functional medicine doctor to ask the question why.
Okay, good. Thank you. Okay, I'm going to do one more question. What type of blood sugar testing kit? What type of blood sugar testing kit should I have? I now have Kerosene seemed to fluctuate. I now have something seems to fluctuate. So what type of blood sugar testing kit should Russell use?
Um, wow. Well, if you could get a continuous glucose monitor, that would be great. Because they're so useful. They'll tell you what your blood sugar is, and they tell you how you react to certain things. And I always give this example because it's the only one I have. And that is someone who got a continuous glucose monitor found out that she could eat bread and it did not make her glucose go up. But if she had, what was it, nachos, her blood sugar shot through the roof. And she would have totally, that was totally unexpected to her because she's thinking nachos, it's a little bit of carbs, but it's got protein on it, it's got beans on it. And so she wouldn't have thought of that, but it went through the roof. So the continuous glucose monitor would be great. I generally recommend the Freestyle Libre. The advantage being it's twice a month, it changes out. It's about $80 for each one. So twice a month, $160 a month kind of cost. And which is not very far off from the finger sticks. If you're paying $1 a strip, which like most people are, and you're measuring twice a day, that's $60 a month right there. So I don't know, maybe a little. Yeah.
Ginger said, I lowered my blockage in my carotid artery from moderate to mild by using the diabetes and healthy heart solution kits. Fantastic. It's awesome.
Wow, that's great.
Yes, that is great. We're going to share that with the team. Thank you so much for sharing that. Okay, Dr. Saunders, thank you so much for your time and your wealth of information. We will see you tomorrow on the Healthy Heart webinar.
Hasta mañana.
Bye-bye. All of you, thank you so much for being here today. We'll be back tomorrow, like we said, on the Healthy Heart webinar. A bunch of questions from you guys. You can find that registration link at bartonwebinar.com. You can register for it for free. It'll send you a reminder. And again, it is at 12 noon Central Time on Thursdays. So thanks so much for being here. And I look forward to seeing many of you again tomorrow, if not next week. Bye.